In this video, we'll discuss about drugs for peripheral vascular disease (PVD). So, what are the drugs we are using for peripheral vascular disease? We will discuss. So, peripheral vascular disease is a slow and progressive circulatory disorder caused by narrowing or blockage or spasm in blood vessels outside the heart and brain. ஸோ பிவிடிங்கிறது வந்து பெரிஃபரல் வாஸ்குலர் டிசீஸ். இது வந்து ஸ்லோவாக ப்ராக்ரஸ் ஆகும் சர்க்குலேட்ரி டிசார்டர். ஸ்லோவாக ப்ராக்ரஸ் ஆகிற ஒரு சர்க்குலேட்ரி டிசார்டர். இது வந்து என்ன பண்ணுதுன்னா நேரோ பண்ணுது பிளாக்கேஜ் ஆர் ஸ்பாசம் ஆஃப் தட் பிளட் வெசல். பிளட் வெசல்ஸ் வந்து நேரோ பண்ணுது இல்லாட்டி பிளாக்கேஜ் பண்ணுது அவுட் சைட் த ஹார்ட் அண்ட் பிரைன். Reduction in blood flow leads to reduction in oxygen supply. So less amount of blood supply நால less amount of oxygen supply நடக்குது. Often causes necrosis. இதனால வந்து necrosis நடக்கிறது. அதெல்லாம் வந்து அதோட PVD காஸ் ஆகுதுன்னு சொல்லி பார்க்க போகிறோம். காசஸ் PVD mainly caused by atherosclerosis, embolism, thrombus, trauma, vasospasm, inflammation, diuretic, vascular insufficiency, ischemic leg ulcer, cerebrovascular inadequacy. ஸோ இந்த மாதிரியான ரீசனால் பிவிடி காஸ் ஆகுது. அத்ரோஸ்க்ளோரோசிஸ், எம்பாலிசம், த்ராம்பஸ், trauma, vasospasm, inflammation, diabetic vascular insufficiency, ischemic leg ulcer, then cerebrovascular inadequacy. What are the risk factors? The risk factor acute peripheral vascular disease are family history, sedentary lifestyle, stress, autoimmunity, smoking, obesity, and hypertension. So these are the risk factor: family history, lifestyle, sedentary lifestyle, stress, autoimmunity, smoking, obesity, and hypertension. These are the some of that risk factor. Then usually that risk factor may leads to increasing blood cholesterol level, and this leads to peripheral vascular disease. Next one, the pathophysiology. So because of this risk factor increasing blood cholesterol, because of that plaque formation on intimal wall causing partial or complete occlusions. Then calcification and loss of elasticity, because of that weakening of wall leading to aneurysm or thrombus formation. Because of that it leads to inadequate blood supply and oxygen supply. Because of various risk factor increasing blood cholesterol, because of that plaque formation, then it leads to calcification and loss of elasticity. Because of that it leads to weakening that wall leading aneurysm or thrombus formation. Because of that it leads to inadequate blood and oxygen supply. Some of peripheral vascular disease. First one is thromboangiitis obliterans. So first disease coming to some of that PVD. First one is thromboangiitis obliterans. Thromboangiitis obliterans, also known as Pager disease. Pager disease is a recurring progressive inflammation. It is a progressive inflammation and thrombosis of small and medium arteries and vein of that hand and feet. So this one is the thromboangiitis, also known as Pager disease. It is a recurring progressive inflammation and thrombosis of small and medium arteries vein of that hand and feet. Next, Raynaud's disease. Raynaud's disease causes some area of our body, such as our fingers, toes, to feel numb and cold in response to cold temperature and stress. ஸோ ரெனால்ட் டிசீஸ் என்னென்ன சிம்டம்ஸ் இது வந்து ஃபிங்கர்ஸையும் டோஸையும் அஃபெக்ட் பண்ணுது. அதனால் அவங்க வந்து நம் அண்ட் கோல்ட் இஸ் த ரெஸ்பான்ஸ். In Raynaud's disease, smaller arteries that supply blood to your skin become narrow, limiting blood flow to that affected area. அதனால் என்ன வருதுன்னா vasospasm. இது வந்து ஸ்மால் ஆர்டரிஸில் வந்து ஸ்மால் பிளட் சப்ளை, இது ஆர்டரிஸ் வந்து அஃபெக்ட் பண்ணுறதுனால பிளட் சப்ளை வந்து குறையுது. இதனால் வந்து என்ன ஆகுதுன்னா vasospasm வருது. Then next disease, aneurysm. An aneurysm is an abnormal bulge or ballooning in that wall of that blood vessels. So arterial embolism. Next, arterial embolism is the sudden interruption of blood flow to an organ or body part due to embolus adhering to the wall of that artery, blocking to that flow of that blood. Next, deep vein thrombosis. This one, deep vein thrombosis is the formation of blood clot in a deep vein, most commonly in the leg and pelvic area. So deep vein thrombosis, these are the some disease. Now coming to drugs used for that PVD. Are the following types of that drugs. First one is rheological agent, then phosphodiesterase 3 inhibitor, then antiplatelet drugs, then antioxidant drugs, then vasodilator. Vasodilator. In these are the type of drugs used for PVD. Then drugs name pentoxifylline. It also called as acipentiphyline. So pentoxifylline, acipentiphyline. Then that phosphodiesterase 3 inhibitor. Example of the drugs clostazole. Then antiplatelet drugs, aspirin, clopidogrel, then ticlopidine. Aspirin, clopidogrel, then ticlopidine. Then antioxidant vitamin E. Then vasodilator, here directly acting cyclone delate, then xanthanol nicotinate, directly acting cyclone delate, then xanthanol nicotinate. So here two drugs, cyclone delate, xanthanol nicolate. Then beta adrenergic agonist, this one isosuprine. Then alpha adrenergic blocker, in this one prozosine, benazobenzamine. Then finally calcium channel blockers, in this one nifedipine, then flotifine, then prostacyclin, which is prostacyclin I2. So these are the drugs used for PVD. So all the drugs one by one we want to discuss. First one is pentoxifylline. This one is analog of theophylline. Analogna structurally similar but different its composition. இது வந்து தினோஃபைலின் மாதிரி ஸ்ட்ரக்சரலி சிமிலராக இருக்கும், ஆனால் அதோட காம்போசிஷன் மட்டும் வேரியாக இருக்கும். So it is a weak phosphodiesterase inhibitor. It is a weak phosphodiesterase inhibitor and increasing the blood flow in ischemic area by reducing the whole blood viscosity and by improving flexibility of RBC. So this one is rheological action rather than this vasodilation. Rheological action அதோட மீனிங் என்னன்னு சொல்லி பார்த்தா குவாலிட்டி அண்ட் எஃபெக்டிவ்னஸ் ஆஃப் தட் ஆக்ஷன். நெக்ஸ்ட்டு சைட் எஃபெக்ட் nausea, vomiting, indigestion, that is stomach discomfort, then floating reducing by taking medicine after meals, then angina, palpitation, hypersensitivity, arrhythmias. So these are the other. So nausea, vomiting, indigestion because of stomach discomfort, then floating, this one reducing medicine after meals, angina, palpitation, hypersensitivity and arrhythmias. These are the drugs used for intermittent claudication. Intermittent claudication symptoms of lower extremities, peripheral arteritis disease, arterial disease. This one is lower extremity peripheral arterial disease due to occlusion of that vascular disease. Then trophic leg ulcer, chronic cerebrovascular insufficiency, then transient ischemic attack. So these are the treatment also used for trophic leg ulcer, chronic cerebrovascular insufficiency and transient ischemic attack. இது மாதிரியான ட்ரீட்மெண்ட்டுக்கு யூஸ் பண்ணுறோம். Mechanism of action of these drugs ன்னு சொல்லி பார்த்தா this one is competitive non-selective PDE inhibitor, phosphodiesterase inhibitor, raises intracellular cyclic adenosine monophosphate level, then activate PKA, protein kinase A, then inhibit tumor necrosis factor leukotriene synthesis, then reducing inflammation, improve RBC deformability and reduced blood viscosity. Because of that, it leads to decreasing potential for platelet aggregation and clot formation. So what is the mechanism? It is a competitive non-selective PDE inhibitor, raises intracellular cyclic AMP level. Because of that, it leads to activate PKA, inhibit tumor necrosis factor and leukotriene synthesis. Because of that, it leads to reducing inflammation, improving RBC deformability, reducing RBC viscosity. Because of that, it leads to clot formation. Second drugs, xylostazol. What is the mechanism of action? This one is the phosphodiesterase 3 inhibitor. This one increasing intracellular cyclic adenosine monophosphate in platelet and vascular smooth muscles. This result in anti-aggregatory and vasodilator effect. So this one, what is aggregatory means preventing aggregation of platelet. ஸோ இது வந்து ஆன்டி அக்ரிகேட்ரியாக நம்ம வந்து பிளேட்லெட் வந்து அக்ரிகேட் ஆகாமல் இருக்க யூஸ் பண்ணுறோம். வாசோ டைலேட்டர் எஃபெக்ட் மோர் எஃபெக்டிவ் தென் பென்டாக்சிஃபைலின் in patient with intermittent claudication. To pharmacokinetics elimination, the lifetime வந்து 12 hour. This one not to be taken with CYP3A4, CYP2C19 inhibitor, not used in patient with heart failure, tissue necrosis, who have pain, even rest. So அதோட லைஃப் டைம் வந்து 12 hours, not be taken, should not be taken CYP3A4 and CYP2C19 inhibitor, not used in patients with heart failure, tissue necrosis, who have pain even at rest. Then side effect, headache, then palpitation, dizziness, nausea, vomiting, increasing in ventricular ectopics and non-sustained vascular tachycardia. Then uses mainly used in intermittent claudication due to occlusion vascular disease in patient with no rest pain or heart failure. Next, antiplatelet drugs. Antiplatelet drugs, often called blood thinner, prevent platelet from sticking together. Platelet வந்து ஒன்னோட ஒன்று ஸ்டிக் ஆகாமல் பார்த்துக்கும் to form harmful blood clot which can lead to heart attack and stroke. அப்படி வந்து ஒன்னோட ஒன்று ஸ்டிக் ஆச்சுன்னா அது வந்து ஒரு harmful condition, blood clot ஆகிட்டு heart attack, stroke வரும். So common antiplatelet including aspirin, which is cyclooxygenase inhibitor, P2Y12 receptor inhibitor, like clofetotrel and ticagrelor. So what are the drugs? Clofetotrol and ticagrelor. These are the drugs used in antiplatelet drugs. Other drugs like dipyridamole, then clozacestol, then GP2B or 2A inhibitor to prevent platelet activation and aggregation. Mechanism of action with the platelet cell, aspirin inversely blockers for cyclic oxygenase 1. So within the platelet cell, aspirin is inversely blocker for cyclic oxygenase 1 or COX1. It is inactivate the enzyme activity, leading to stoppage of that cascade, which producing TXA2 thromboxane A2, which inhibit platelet aggregation between platelet blood cell. Platelet cells, இது வந்து என்ன பண்ணுது, பிளேட்லெட் செல்லில் அஸ்பிரின் வந்து பிளாக் பண்ணுது COX1. இதனால் வந்து ஸ்டாப் தட் TXA2, அதனால் வந்து இன்ஹிபிட் பிளேட்லெட் அக்ரிகேஷன் பிட்வீன் தட் பிளேட்லெட் அண்ட் பிளட் செல். ஸோ ஆஸ்பிரின் போயிட்டு தட் பிளேட்லெட் செல்லில் வந்து பிளாக் பண்ணது COXை, அதனால் அது வந்து ஸ்டாப் பண்ணுது TXA2வை, அதனால் இன்ஹிபிட் பண்ணுது platelet aggregation. Then what are the drugs? Aspirin, mechanism of action, inversely inhibit platelet prostaglandin synthetase. Use வந்து intermittent claudication-க்கு யூஸ் பண்ணுறாங்க. Then side effect, upper GI burning, then abdominal pain, gastrointestinal burning, abdominal pain, heartburn, nausea, constipation. Next drugs, diclofenac. Mechanism of action, inhibit binding of macromolecules to glycoprotein 2B3A complex during aggregation. இது வந்து intermittent claudication with aspirin, reduction in adverse CV, cardiovascular event. Then side effect, diarrhea, nausea, rashes, bleeding, நியூட்ரோபினியா, அதாவது லோ பிளேட்லெட் நியூட்ரோஃபில் கவுண்ட் குறையுது. தென் த்ராம்போசைட்டோபினியா. தென் குளோஃபிடோக்ரெல். இந்த ட்ரக்ஸ் வந்து மெக்கானிசம் ஆஃப் ஆக்ஷன், ப்ரிவென்ட் த பைண்டிங் ஆஃப் அடினோசின் பைபாஸ்பேட் மாலிகுல்ஸ் டு தட் P2Y12 receptor on platelet surface, inhibit platelet activation and aggregation. Uses in patient with symptomatic peripheral artery disease, reduce the risk of MI in patient with non-STEM1 or STEMI STEMI, that means non-ST elevation myocardial infarction. Side effects: shortness of breath, bleeding, headache, seizure, weakness, and jaundice. Next category of drugs, antioxidant, vitamin E. This one is the lipid soluble antioxidant. Terminate oxidative chain reaction by the interacting with the lipid paraxyl radicals. Then prevent formation of free radicals. Cell damage that occur in ischemic period in all tissue is probably caused by free radicals. Additionally, it has been found these are some additional mechanism inhibit that platelet aggregation, lower blood cholesterol levels, stimulate that formation of collateral vessels. Then vasodilator, no vasodilator alone can overcome the organic obstruction. They are more useful when vasospasm in wholly or partially involved in Raynaud's disease. Then next drugs, cyclin delate. Mechanism of action: peripheral vasodilation, smooth muscle relaxant, increasing blood flow. Uses: intermittent claudication, atherosclerosis, renal disease. Effect: side effect: flushing, palpitation, headache, gastrointestinal distress, and tachycardia. Then next drugs, xanthine nicotinate. Mechanism of action: increase the blood flow in many vascular bed and increasing glucose metabolism and energy gain. Uses: peripheral vascular disease, cerebrovascular disease, and hyperlipidemia. Side effect: irregular heart rate, flushing, headache, and GI distress. Isosuprine. Mechanism of action: direct relaxation of uterine and vascular smooth muscles via B2 receptor. Uses: cerebrovascular insufficiency, thromboangiitis, then obliterans, Raynaud's disease, atherosclerosis. Side effect: rashes, nausea, vomiting, hypotension, and dizziness. Then prazosin inhibit post synaptic alpha 2 adenoreceptor, block that vasoconstriction effect of uh, acetylcholine on vessels, then leads to peripheral blood vessels dilatation. Uses: hypertension, post-traumatic stress disorder, Raynaud's disease. Side effect: palpitation, headache, nausea, vomiting, and weakness. Then phenoxybenzamine. Mechanism of action: non-selective, irreversible alpha blocker leading to muscle relaxation. Uses: PVD. Then hypertension. Side effect: relax, reflex tachycardia, flushing, and GI distress. Then nifedipine or philodipine, a blockage, old cated L-type calcium channel in vascular smooth muscles and myocardial cells. Prevent calcium entry, reduced peripheral artery and vascular resistance. Uses: PVD, angina, hypertension. Side effect: hypotension, palpitation, flushing, ankle edema, and headache. One is prostaglandin I2. This one mechanism of action: inhibit platelet aggregation and effective vasodilator, used for pulmonary artery hypertension. Side effect: irreversible hypotension, platelet loss, flushing, and headache. So this is the mechanism of action of prostaglandin I2 action. This PGI2, this one will bind to that IP receptor. It is presented in cell membrane. Then activation of adenyl cyclase. This leads to increasing cyclic adenosine monophosphate level. This one will activate pKa. Then protein kinase A. Then relaxation of smooth muscles. Then reduced cell proliferation and other inflammatory mechanism. So this is all about that mechanism of action of prostaglandin I2. What are the drugs we are using for peripheral vascular disease? Peripheral vascular disease, what are the disease example? Um, என்னென்ன டிசீஸ் ஒன் பை ஒன்னாக பார்த்துட்டு அதோட மெக்கானிசம் ஆஃப் ஆக்ஷன் என்னென்ன ட்ரக்ஸ் எடுத்துக்கிறோம், அதோட மெக்கானிசம் ஆஃப் ஆக்ஷன் என்ன, இதெல்லாம் டைப்ஸு, இதோட ட்ரக்ஸோட நேமு, எல்லா ட்ரக்ஸும் ஒன் பை ஒன் டீட்டெயிலாக பார்த்துருப்போம். பென்டோசிஃபைலின், அதோட ஆக்ஷன், மெக்கானிசம் ஆஃப் ஆக்ஷன், சைடு எஃபெக்ட். Xylostol, antiplatelet drugs. Antioxidant vitamin E. Thanks for watching.